Assalamu alaikum and welcome to another program of Ramadan for Better Health. Thank you for tuning into the program, and we hope inshallah that your Ramadan fasting for the holy month of Ramadan is being successful so far. Today we're going to be talking about obesity. This is something that we need to be very careful about and aware of. We're going to be discussing some of the details and nuances of what obesity is, how to avoid it, and what the negative implications are. And also we're going to be looking at surgery as a solution to very obese people. We're joined by a well-qualified doctor of medicine. He's a surgical consultant. This is Dr. Tamer Rashidin. Assalamu alaikum. Welcome to the program, doctor. We're talking about obesity. Before we talk about this, tell us a little bit about what it means to be a surgical consultant. What does that mean?
To be a surgical consultant, you have to have two things. First, a qualification, master degree followed by MD degree, then an experience ranging from 5 to 10 years at least to be a consultant.
So you're very highly, as we said, very highly qualified to discuss this issue. Have you actually performed surgery on people who are obese?
Yes.
All right. So we're dealing with, like we said, a well-qualified person to deal with this. I think when I look at BMI indexes, these charts that tell you based on your age, height, and weight, that I'm actually overweight. I like to think that that's because I have a lot of muscles, but I don't know. What is the difference between being overweight and obese?
Simply, obesity is to have much weight over your ideal weight. Your ideal weight is related to two things, your age and your height. Body mass index is a simple index done by the WHO organization to say who is overweight, who is obese, who is underweight, how to calculate body mass index, or simply we say BMI. BMI calculated by doing weight over height in centimeter, double the height in centimeter, your weight and the square height in centimeters. This equation will give us a number. This number ranging from 18 to 25. From 18 to 25 it's accepted. But between 25 and 30, this is overweight. Between above 30, this is obesity. If you are between 25 and 30, which is called overweight, you are going to have a problem. The problem is obesity, above 30. Above 30, we are classifying obesity to three classes, between 30 and 35, between 35 and 40, and above 40. Between 30 and 35, it's mild obesity, 35 to 40, moderate obesity, and above 40, this is a big problem, which is called morbid or super obesity.
Okay, so mild obesity,
moderate obesity, super obesity,
and super obesity,
or morbid obesity.
Or morbid obesity. Okay, so we have three. The professionals like yourself have created these international standards.
But everyone, every patient, every normal person can calculate his BMI.
Okay, again, what's the equation, the formula?
Yes, the equation above is the weight in kilograms.
In kilograms.
Down is the height in meters.
In meters.
Square the height. Square the height in meters.
Okay.
If you are weighing 70, you have about 70 above. And if your height is 100 centimeter, 0.8 centimeter, about 101.8 squared down. Then you will get the number of your BMI.
Okay.
So if you have BMI above 30, you should know that you have a problem, a real problem.
30.
Above 30, you have a problem, real problem. Not just for your shape or your lifestyle, but a problem for your health. All over the past decades, we considered obesity as a risk factor for many diseases. We will say it now.
Okay.
But now we are considering obesity itself a disease. So, if you are having BMI above 30, you are diseased, and you need treatment. You need to see a doctor and to treat you.
So we're talking about something that's not just about looks You know, it's not just one thing to have to buy larger clothes, and we're talking about something that's serious that could affect your very life.
Yes.
And your quality of life. So it's important for people to use the BMI as to start with,
Yes,
right?
yes.
And then go to work with the doctor, right? What are the objectives that the doctor, what can people expect when they go to see a doctor? And let's say that they have this high BMI.
There is a scale, there is a stairs you have to go up to manage your obesity with a doctor. First, your lifestyle, your habits should be modified. You should go into an exercise program, should go into a diet program. These three things, your lifestyle and exercise and diet, basic parts of any treatment program, whatever your BMI, 31 or even 50.
Okay.
You should go into the three. First, willing and ambition. And to know that you have a problem, three things very important. If you don't know that you have a problem and have the willing to solve the problem and the ambition to be a normal weighted person, will be a problem. Look at this child. What to eat? These fruits and vegetables, so it's healthy, not increasing the weight, improving the vitamins, or this pre-cooked food and pre-made food, which is full of non-saturated fats or saturated fats, and increasing your weight, increasing the risks. Much risks are being inside your food. What's the risks? Especially we are in Ramadan and talking about our foods. The risks in the food is to increase your weight. Increasing your weight will carry a risk on all your systems, starting from the heart up to the brain, up to your vessels, your lungs, your GIT, your knees, your back, everything will be affected by obesity.
But doctor, you're an Egyptian. You know what the culture is. You know, when we have these big meals with the family, the expectation is there's a lot of pressure for you to eat these things, and so we're asking people to cause trouble, right?
So I have said, to know you have a problem, to have the willing, and to have the ambition. Look at this small picture. Small picture, but having much problems. Every system in the body, starting from the heart, atherosclerosis, essential hypertension, going to GIT, this heartburn and reflux affecting most of us, especially in Ramadan. This is peptic ulcer, colonic problems. This brain will be affected by depression, where stroke in old people, affecting your knees and your back.
Yeah, I see, doctor, these indication, everything from head to toe.
Every system is affected badly from this obesity. So you should know, and everyone should know, that this is a big problem, big health problem. It's classified now as international public health crisis.
Okay, give us some numbers. How many people are affected by this? What are their percentages?
Actually, about 30% of the people, especially in the Western countries. In the Western countries, we have more data and applicable data research. 30% of people, it's a big percent of people, having this problem.
This is 1/3.
Yes, one-third of our...
And out of this 1/3 who have this, we're talking about obesity, not being overweight.
Yes, obesity.
Okay, 30%. What about the breakdown with the sexes, men and women?
And females more than males.
More with females.
More than males. And now the problem is evolving in the adolescents and the children due to much factors, starting from genetics and psychological factors and behavior and lack of exercise and unhealthy food like this. All these are contributing to increase the problem magnitude from childhood and adolescence.
Why more in women? Is it because of...
lack of exercise. It's the center point. And some hormonal factors, some factors related to pregnancy and lactation and psychological changes, much things.
Okay. Is it fair to say women generally are less active, or, I mean, physically, or is that not a factor?
There is a good proportion of females not going out for work, just working at home. So neglecting exercise, and exercise is something different from work. Every one of us much knows that. Exercise is have a technique, have a duration, different from work.
You must elevate
Many
the
of
heart
our
rate
patients
for,
say, I am very tired from work, so I am doing exercise. This is not exercise. This is tiring you, but not an exercise to improve your health.
Yeah. Okay. So, like you said, we're in the month of Ramadan. The culture is infused with people reaching for these sodas, these fizzy drinks like Coca-Cola and others. Going to talk a little bit about this.
So, you should eat much healthy food, less unhealthy food. What's healthy and unhealthy? My two daughters, Jana and Judy, taking it in the school, saying for him, this is healthy, this is non-healthy. From being young, he should know what's healthy and unhealthy. We should educate this to our children. What's healthy and unhealthy. All the pre-made food, all this flavored, and all this soda food, soda drinks, unhealthy foods, giving much calories with less vitamins.
Yeah.
But when you are going through vegetables, through fresh juices, homemade, through fruits, these things, healthy meat with little fat, these are healthy foods, not unhealthy foods, which are the habit of most of us. Less.
Yeah. Okay. All right. Dr. Tamer, we're going to take a short break right now. Yes. Dear viewers, we're going to take a break and we will be back to continue the program about obesity. Assalamu alaikum.
Welcome to Cosmic Proof, the one and only program that leads you to the truth wherever it is, for my sake and your sake.
Assalamu alaikum. Welcome back to the program Ramadan for Better Health. We're discussing the issue of obesity. It affects 30% of the population based on our discussion here with brother Dr. Tamer Rajdi. All right. So let's talk about, unfortunately, the situation can be so serious that some people have to opt for surgery.
Yes.
Right? Okay, but before we get to surgery, what are the steps that doctors, as yourself, try to alleviate the problem before surgery?
I said before, every patient should go into steps. First of these steps is diet control, exercise control, changing the habits of feeding and exercise, lifestyle modifications. Then, if the body mass index is above 27,
yes,
they may take medications or pharmacotherapy. Medications are many types of medications, decreasing appetite or decreasing absorption or digestion of food. This is considered the stage A of treatment.
Okay.
Every patient should go into this stage. But there is a group of patients, according to BMI, above 40. If BMI above 40, we shall go into surgery.
Okay.
Or if BMI between 35 and 40, but the patient have other comorbidities, other risk factors for disease, like hypertension, diabetes, especially type 2, taking oral medications, or osteoarthritis, or problems about his back or knees, or problems about breathing, especially at night. These comorbidities could be corrected by surgery. So we are going to less body mass index to choose surgery. This picture showing 3 famous and the most worldwide done types of surgery. From left to right, the first is adjustable gastric band. The adjustable gastric band, like you are seeing, this is a band around the stomach to decrease the capacity of the entrance of the stomach, to decrease how much food can the patient take.
Now this band, it's inside the body.
around the stomach itself. But it's
around-
connected to this small ball at the end of it, which is subcutaneous. This ball is used to inflate this band to decrease or increase its capacity according to the weight loss of the patient. So it's controlled somewhat by the patient and his physician. But this method may be reversible, not without complications, but success rate is less, especially in our Arabic world. Success rate is less. The two second methods is the most popular worldwide nowadays. The Roux-en-Y gastric bypass surgery. Like we are seeing, we are cutting and separating a part of the stomach. So we have a new stomach for food. This is a small one. This will take us to restriction of the food taken, because this new stomach will be 150 centimeters cubic centimeter capacity, small capacity, very small capacity.
Reducing the size of the stomach.
Capacity of the stomach. How much food it will take, it's very minimal. Also, there is another element in this surgery. We are bypassing much of the intestine. You are looking, we are taking part of the small bowel to attach it to the new stomach. So the new stomach is putting its food directly to the distal bowel.
But doctor, doesn't this eliminate, I mean, there's some critical functions that happen.
Yes, yes. We will talk about that.
Okay.
And the risks of surgery.
Okay.
And the follow-up of the surgery. The third surgery is a vertical sleeve gastrectomy. Vertical sleeve gastrectomy is a more simple surgery than Roux-en-Y gastric bypass. We are taking part of the stomach and leaving a small sleeve of the stomach. Small sleeve of the stomach, so smaller capacity of the stomach. And it is also a successful surgery.
With all respect to you, doctor, to you and your work and your profession, I don't like any of those options. I think it's better to prevent. You know?
This is the point.
Yeah.
So we have talking about it in the few minutes before. There is benefits and harms. What is the harms? Much harms. All the systems of the body are harmed. What is the benefits? This is the benefits of surgery, but there is harms for surgery. You have your GIT changed almost. You will have to take vitamins and minerals all over your life after surgery.
Yeah.
Every day. And you have to be followed up by your physician every 3 months, 6 months, 1 year, all over your life.
So is it fair to say that in these cases, people who have any one of these 3 procedures done, it's for the sake of saving their lives?
Saving life, yes, saving life. We will lose some things. We will get some suffering, but to save the life of the patient.
I see.
Yes.
So the option is, you know, do nothing and face a much shortened life, or do these very invasive procedures. Okay, so the people, you said in some cases, they automatically go to stage, you said stage A, you know, try and regulate it with tablets and things like this.
Diet and tablets and exercise.
But some people, depending on how severe or how advanced they are, they go all the way to the final stage, which is the surgery.
Above 40. Above 40. If you are above 40, you will go to surgery. This is the only and the golden rule to lose weight and sustain this weight loss.
All right. What about open surgery, opening the body itself to do this, or not opening the body?
Yes, yes. All these surgeries, and we have seen 3 types only. It's much more types, but there's most famous 3 types. All these surgeries can be done open by a wound, which is maybe 7 to 10 centimeters or more, or laparoscopic, through small incisions.
I think we have a video for the laparoscopic.
We may see it as an animation of laparoscopic sleeve gastrectomy. We have 4 or 5 openings, every one 0.5 to 1 centimeter. Which is better, laparoscopic or open surgery? For most, not all, patients, laparoscopic surgery, like these, the openings, the small openings, and we are introducing our instruments through special boards to get into the stomach. You are seeing now the stomach, and this is the normal pathway of the intaken food and the normal capacity. See how full is the stomach now by food.
Mm-hmm. And the different colors mean different phases
This
of digestion?
green is the enzymes going
okay.
in the intestine. Now, by using of special staplers, we are separating this part and leave only this small sleeve with capacity 150 centimeters cubic to accommodate food, and we leave this removed part out of the body.
Wow.
Yes. It may be for you aggressive, but for this patient who will face her fate about cardiac problems, diabetes, hypertension, and depression, and the change of look to himself, it's very beneficial.
Now, after performing these procedures, does a person actually lose weight?
For these procedures, I will talk collectively, not to differentiate procedures. We are talking now about the excess weight, not the weight of the patient. Yani, look, if you have 100 kilometers excess weight, your weight is 200 kilometers, morbid obesity. You have 100 kilometer excess weight. This 100 kilometer with these surgeries done in the right patient, by the right way, and the patient follows the instructions and adhere to it strictly, he could lose about 80 kilometers.
Wow. Okay.
Of the 100 kilometers excess weight.
Extra,
How much time? In 1 to 2 years. And at the time of 1.5 or 2 years, he will sustain the weight, but only if he adhere strictly to the instructions of the post-operative.
Now, we're not talking about people, who want to look better and get inside the, the genes or whatever. We're talking about people who have a serious medical condition.
And also the psychological status and the emotional status and the sociological look of the patient is very important. He wants to see himself better and to have much exercises he cannot do with his now weight, with his children and his wife and everyone, and going out and making some games and playing football, much things.
Now, doctor, about the patients who undergo these procedures, what about the breakdown? You talked about women and men. What about children? What part of this do
children and adolescents? Children and adolescents now is a rising population and this health problem. And now we are going to increase the surgeries for them, but with more strict guidelines.
Okay.
Higher body mass indexes and exclusion of all the hormonal causes and endocrine problems and much things not so easy like the adult. We are going with more strict guidelines and less patients to operate in this age group.
So it's done, these actual surgeries are done on children?
It may be done, but not like adults and much patients and everyone going beyond 40 body mass index. No, strict, more strict,
very strict.
And more higher body mass index, and also if there is risk factors, it will be more applied.
All right. So for people, we've got about 1 minute before we reach the end of the program, so we're essentially going to close out now. In this final minute, speak directly to people who may be facing this right now. Either they're obese, they know it, maybe they're working with a doctor. What advice, what words would you give to them?
Only one advice. Every one of us is afraid from surgery. And every one of us is afraid from the complications of surgery. No surgery without complications all over the world. But you should know that surgery is the only clue for your problem. If your body mass index is between 35 and 40 and you have diabetes or hypertension or other problems, or your body mass index without diseases is above 40. But you should know an important thing: diet and exercise is an essential part of the post-operative years all over your life. Surgery is not an alternative for exercise and diet.
Dr. Tamer Rashidi, he is a surgical consultant dealing with the areas of obesity and digestive health. Thank you so much for being with us, doctor.
Thank you.
All right. So we will end our discussion here about obesity. It's a very serious issue. It impacts all the systems of the human body. We hope, inshallah, this was beneficial for you and that you can have a more fruitful Ramadan. Try and do things that are healthy to prevent entering into this state to begin with. Prevention is always better. So thank you again for tuning in. We'll be back with more, inshallah, with more better Ramadan for better health. Assalamu alaikum wa rahmatullahi wa barakatuh.